Dr. Shelly Delano Parker is an adjunct professor in UMB's Department of Psychology. Now retired, her former position was with NB Power in the Total Health and Safety Group as the Industrial Psychology Specialist. She also held the role as corporate ombuds. Using the scientific perspective of the field of applied psychology within an industrial setting, she developed a unique psychological approach to safety, thus reducing workplace incidents. This resulted in NB Power being the recipient of 2 National Gold Medal Awards, Canada's Safest Employer and the Psychological Safety Award. Dr. Parker's research has focused on the contribution of email incivility to psychological distress and anxiety, for which she has received the Canadian Psychological Association's National Award for Academic Excellence in Research. She currently is examining workplace stress, attention, and the mitigating role of mindfulness, as well as the use of art therapy and graphic silhouettes related to reducing student anxiety. Dr. Parker teaches health psychology, developmental psychology, and research methods, and introduction to industrial organizational psychology at the University of New Brunswick. And I believe I have word that our interpreters now have full access to the channel. So I'll just remind our speakers for this afternoon to be mindful of the fact that they're being interpreted while they speak and not to go too fast. And you can take it away, Shelly. Thank you.
Thank you very much, Amber. Hi, everyone. It's an absolute honor to be here with you all today on this gorgeous September day and critically discussing something near and dear to our hearts, psychological safety in the workplace. So what I am about to do is to share my screen. Oh, sorry, Amber, you'll have to stop, I guess, for me to share my screen.
Oh, great. I think that our Zoom admin might need to give you permission to do that.
Oh, okay.
Just stand by. They were just frantically trying to help me with the interpretation issue.
That's right. Sorry.
No, that's fine.
And again, we kind of have to be cognizant that sometimes technology likes to make sure that it has the upper hand.
Great. Do you have access to screen sharing now?
I do.
Perfect.
Let me just pop all this down. Can everybody see the screen?
I can see it, Shelly.
Perfect. Thank you. All right. Thank you. So the topic today that I would like to share and get your perspectives on is looking at psychological safety in the workplace. You know, it sounds like it's just the most amazing thing to have going. And for some of us, we believe that it's common sense to have a work environment that individual psychological safety. But the reality is actually, you know what? We already have this massive safety management system, usually saying our physical safety needs are met. We have things like safety system management tools, we have standards, we have work methods, we have the right equipment, you know, all the visitation rules, recommendations, etc. They're all set up. Our employees know how to work safely in the field, so why do we need anything more? We're doing good. However, if we had such great physical safety systems, why are we still having accidents? That's the sad reality of our situation today in a work environment. You know, very simply put, if the physical safety system worked, we wouldn't be seeing what we're seeing today. For example, in 2022, there were 242 workplace fatalities in the workplace, and just as many, if not more, approved claims for occupational disease. So the disease comes from a variety of different areas, but that's excluding COVID. We're not talking COVID here, guys. We're talking about other types of things like lung disease from working in dust-filled environments, etc., cancers, etc. So we have to recognize that we're not doing as great as what we think we're actually doing. Worker deaths in 2022 were estimated actually to be 10 times higher than that 242 number that was established. And what we have to recognize also is that even though we have nicely collected all these numbers on physical safety, it doesn't really tell the whole picture as to what our employees are experiencing. And some of you may have seen and heard these numbers before, and if I'm repeating it, I apologize. But sometimes it's nice to just be faced with the reality of what we're working with. In today's workplace, for example, we have these challenges where employees, they're so motivated to achieve. We refer to that as summit fever, where if you think of somebody trying to climb Everest, for example, and they're so focused on getting to the top that they fail to recognize all the safety infractions that they're actually experiencing as they attempt to make their way to the top. Well, in today's workplace, the summit is actually the need to continue to achieve moving further and further up that management scale. And while not always in encouraging or encompassing things like safety infractions, sometimes rules get broken on the way up just to try and achieve. And it's not that they're done maliciously or deliberately. Sometimes it's just the motivation and the urge to get there that leads people up that particular path. We have a lot of workplace issues. We know that companies are changing, companies are merging, companies are folding. It's a sign of the times. There's a lot of competition for very few jobs in particular levels. Although we do know, for example, that there are huge staffing issues in a lot of retail, in a lot of service industries. There's simply not enough employees to fill the available space. We have gender issues. Individuals who have identified themselves as a gender that they're more comfortable with than what people may have previously recognized as being connected to that individual, they're now attempting to make themselves known. And there are issues associated with that if it's not well accepted. But a lot of times it simply means there needs to be more education. We have work and family life scenarios where a lot of individuals who are trying to raise families, for example, they're being asked to work so much overtime that family is taking a back burner to it. We have something called burnout. A lot of previous information led us to believe that burnout was an employee issue. They're just working too much. They're taking too much on. They're not recognizing when they should take that vacation, when they should literally quit that work effort at 5 o'clock and go home like everybody else is doing. But you know what? Burnout was established by the World Health Organization as being an organizational issue. It's the organization at fault for not being able to manage or control the amount of work that employees feel that they need to take on. So it's resulting in employees just doing more with less. And you know what? The gas tank's just simply empty. They don't have anything more to give. Home issues, well, we're familiar with this. Single parent families trying to raise children, trying to earn a half decent salary where they can provide, but still meeting the needs of those children, meeting the needs of family while also meeting needs of the organization. Multiple roles, children, school's gone back in. We know that those after school resources are going to kick in as well. There's a lot that's taking its toll on employees who are attempting to do their best, both at home and in today's workplace. So it all boils down to simply, you know what? People are just simply experiencing a lot of pressure. Regardless of what way we want to look at it, the pressure exists. So what does this all mean? Well, again, just a little bit more information, more stats for you. Today, while we're together, while we're talking about psychological safety, psychological health in the workplace, there's approximately 200,000 Canadians fully employed who simply can't go to work today for a mental health issue. Some of these individuals, they just can't even get out of bed. We have to recognize that number. We have to recognize the value that stress is playing in all of this. And what I've just mentioned on the previous slide, that boils down a lot of times to just simply being unable to manage the what we now call the normal day-to-day stressors of a work life. And it's referred to as the unseen culprit. But all of this, there's a price tag associated with it. Companies are paying approximately 50 billion, not million, but $1 billion a year to pay for all of these concerns and issues that are occurring in our workplaces. And you know what? As we sit here today, think of your own workplace, because we're not immune. We are definitely not immune to this particular type of conversation, to these statistics. These stats cover where we work as well. So we have to recognize that looking at a $50 billion price tag per year, and that's in Canada. That's not North America, that's Canada. That's a big dollar amount. We can work to change that. We can change it by looking at how we can implement psychological safety. Now, our standard psychological safety in the workplace was created in 2013, 10 years ago, and it's published by the Canadian Standards Association. And how it defines psychological safety is, a workplace that's psychologically safe is a psychologically healthy and safe workplace is a workplace that promotes workers' psychological well-being. But critically, it actively works to prevent harm to the worker. To me, that's a key word, the actively works. So essentially, it's not a one and done. It's not putting in all these programs. It's not overseeing all these actions or activities or training programs, etc. It's not just putting in, overseeing, ticking off the box and saying, yeah, we did it, that standard's implemented. No, it's being active. It's continuously looking, upgrading, assessing, making sure that this is always on the forefront. It's always being utilized. That's hard to do. So if we continue with the that's hard to do scenario, look at what the standard actually consists of. So backing it up just a step, the standard was created by a combination of groups. It was created by the Mental Health Association of Canada, the Mental Health Commission of Canada, in collaboration with a lot of medical groups, as well as the Canadian Psychological Association. So all of these groups got together and they all provided input as to what the best concepts would be that would look after and ensure psychological well-being for employees in Canadian workplaces. And what they've settled on are these particular 13 factors. So, for example, obviously, we want to say, you know what, it's a company that provides psychological and social support. Well, that's really good. And that just simply means that the work environment supports employees' physical, psychological, and social health concerns. And I'm throwing the word physical in because the Canadian Psychological Association always includes physical as well, so that you have all areas covered. Because if you're not physically safe, it does impact your psychological health and vice versa. We have to know that the culture of the organization has to be one that supports fairness, for example, that supports trust, honesty. We've learned a lot about culture from our first speaker this morning when, speaking of the First Nations Aboriginal experience and how we have to be more aware of culture training within our workplace to make sure that it doesn't become any more of an issue than what we know historically it had been. So we have to make sure that organizational culture is one of our key factors. Clear leadership and expectations. Well, it kind of makes sense that we think that leadership is effective, but not always. So by actively managing this and making sure that employees are aware of what the expectations of them actually are as established by leadership, that's really helpful. It makes knowing what you have to do that much easier. And going forward, there's no confusion. Civility and respect, that is such a key aspect. And that's nicely looked after as well by our legislation. You know, we have the respectful workplace policy that most companies in Canada now adhere to. All companies in New Brunswick are required to. So that is one of our factors. Psychological competencies and requirements, it's simply making sure that employees' jobs fit their particular needs, their particular abilities. You know, that person job fit scenario. Growth and development. Are we providing, you know, I come from a utility industry. Are we providing apprenticeships? Are we providing training? Are we providing continual encouragement for employees to constantly go and upgrade to make sure that, you know, their overall education experiences are available to them? Recognition and reward. How many companies, and I hope every one of you can say, my company does, you know, how many companies will turn to an employee every so often and say, you know what a great job you just did. Is there any recognition? Is there any reward given for a job well done? Involvement, influence. How much involvement do employees have in workplace committees, for example? Can an employee be involved in looking at the standards that are being used from a safety group? And what about just workload management? Remember, I discussed burnout. Is the environment one where the tasks, for example, responsibilities that employees are taking on, can they be successfully managed within the time allotment that people are given? What about engagement? Are employees eager to assume their job, assume their responsibilities of the day? You know, are they promoting the company? Do they believe that the company has their overall well-being at heart? How engaged are they in their work? And again, that balance of work and life. When you come home at night, do you turn off your cell phone? Do you make sure that you're not involved in work activities so that you can focus on family, so you can focus on maybe your own needs, maybe get to the gym, do a little bit of social interaction with friends, etc. What's that balance of work and life actually like? Years ago, I was able to attend a conference where this wonderful speaker, she stood up and she said, you know what? We use this phrase work-life balance all the time. She said, I don't like that. And I don't believe it's even one that we should consider anymore. She said, it's not a balance that we can achieve easily. She said, in my mind, it's a balancing act because one day we might have more work than we have social abilities or personal life. And the next day it might flip. And maybe our workload's not as heavy, so we can engage more in that life balancing side. I really like how she put that. So although one of the factors is balance of work and life, let's kind of add that balancing active verb in there to see if we can maybe get around it a little easier. What about psychological protection? What's that going to do for us? Well, again, that's our respectful workplace policy kicking in. It's violence in the workplace training. It's perhaps looking at how we can meet constantly with employees, with each other, just to make sure that we're being okay. Maybe it's even bringing in mental health training for employees, for leaders, so that they can recognize where this has to be. And again, protection of physical safety. That is the standard. That is our physical safety management system. Most companies have that, but again, that depends a lot on the size of the company. And we know that smaller companies just simply can't afford a large management system. However, most companies do abide by a safety management system from a physical perspective. So those 13 factors are critical, and they are the factors that comprise the standard. Okay, so we know what it all is. Let's look at it a little differently now. How about implementing it? If I ask, how many of you have implemented psychological safety in the workplace? Would 50% of you perhaps say, yep, we did? I only know of 2 companies in the utility business in Canada who actually started down that path. So what I can tell you from a personal perspective is one particular company started actually discussing the implementation back in 2013 when it was published. It was an interesting discussion, because we have to look at the reality of what that discussion actually meant. So 'twas the night before Christmas and all through the land, and you'll see the sad little face. The discussion on implementing that particular standard took place on Christmas Eve, not morning, but late afternoon. So the night before Christmas, at the office on a conference call to 12 other utility companies across Canada, where we presented the standard, the national standard, and we asked for support from the other utility companies in Canada to help us put this standard in place in all companies, in all utilities, electrical utilities across Canada. Anybody want to guess as to what the answer was, what the response to our request was? Sorry, I'm putting you guys on the spot here. And I know it doesn't leave much for interactivity, but
Yes, I think it's just the Q&A in the chat that people will be able to participate in, but
right.
do feel free to drop anything that you'd like to add.
So thank you, everybody. And if anybody wants to add to it, I'll let you know what the actual response was. Zero. There was no support from any company to implement that Canadian standard for psychological safety in the workplace. And you want to know why? The big factor? People were having very solid, very intelligent conversations on the cost of implementing programs to support the 13 factors. They felt that it would be too costly and the money would be best spent to keep people physically safe. Makes sense when we think of it from that regard.
We had somebody in the chat say exactly that it probably wasn't positive and considered too expensive.
Wonderful. Thank you. Yes, we're on the same line. And you know what? When we consider what those costs today are related to, for example, mental health issues, related to burnout, which is not, remember, not a mental health issue, but an organizational challenge to try and manage the amount of work that employees have to cover. So when we pull all that together, and that $50 billion price tag sitting there, what would be cheaper? In my mind, it would be simply, let's implement. However, we have to take into consideration 10 years ago, no, these programs weren't readily available. And I would like to think that a standard that was established 10 years ago by now would have taken off. People would have been so highly attuned to the needs for all of this that they would definitely have put their hand up and said, yeah, let's do this. But unfortunately, no, that's not the way it was working. So if we continue, the real timeline, it's what we call event-driven. So when did the standard actually go into play? Well, a few things took place first. 2014, those who were around New Brunswick in that time frame, you might remember Hurricane Arthur. It hit hard. Electrical utility, NB Power, they were tested to the limits as to how to keep workers safe and how to get the power back on for the residents of the province, because that's the key activity, right? Meeting the customer's needs. Power needed to be restored. What happened? We recognized, okay, this is an opportunity to start pulling in some of these aspects of that safety standard. So we started with just something very simple, just getting people to calm down, just getting people to breathe, just getting them to recognize the role mindfulness can play in that physical safety side. So all of the company was trained very, very easily, very quickly, plus 242 contractors that came in to help us out, all in the concept of just taking deep breaths for 60 seconds. And you know what? They named it Up Your 10 based on a concept called 40-10-50, which is, it sounds like a weird number, and it is, but it's just related to percentages of our conscious thought at any point in time. And at any point, 40% of our conscious thought is kind of taken up with previous little blips of memories of information that quickly go in and out of our consciousness. 50%, as I talk, you might get a little blip like, oh, yeah, I have to do this or that. 50% of our conscious thought taken up on things that will happen in the future, leaving 10% for us to pay attention to the moment. That's referred to as 40-10-50. And employees said, you know what? If we do that breathing exercise, and if it helps us be more focused, I guess what we're doing is upping our 10. We're really being more focused on the moment. So they bought it, they owned it, they named it, they took it. That is what kept them safe. In that horrific moment of Hurricane Arthur, first time ever in a major storm scenario, that particular utility had 0 incidents. And these people worked hard for 3 weeks. Horrific conditions, but they did it. They paid attention. In 2015, 2016, again, those 13 factors went through early stages of implementation. We kept focusing on what employees liked. They liked that 40-10-50 concept. They liked the breathing exercise. We added in other things called, for example, safety drives. Very simple. We know what a bottle drive is, a food drive. Why not hold a safety drive? And it was just simply stating, you know what prevents you from working safely today? One question. The employees gave tons of information that we could work with, we could change, we could help, we could make their world safer. Second question, what processes prevent you from working safely today? They told us it was horrific to enter their time on tough books, et cetera, et cetera. We were able to work with that. And then what psychological issues prevent you from working safely today? And that was when the dam broke. That was when all the thoughts, all the talk, all the action just poured out of them. And we were able to help. We were able to provide resources. We were able to put the executive through mindfulness training. We were able to get the executive out into what we call field visits, get them out to visit employees, to check on them, to make sure that they're doing okay. We created a management tailboard form, which is just simply a pre-job checklist for them. Employees had them, why not management? And we created all that under the umbrella of We Don't Need a Better Hard Hat. That was the title of our psychological safety program. And a lot of these things, they just simply worked because a lot of them were just simply employee driven. That's where it had to come from. What did it result in? Well, best safety record in the utilities history for 3 consecutive years. It reduced our medical aid events by 97%. Go back to that original number of 242 fatalities annually for 2022 in Canada. And I mean, let's face it, we don't have the huge number of accidents that a larger province, for example, would record annually. But any accident, any fatality is just simply one too many. It's unforgivable. It's unimaginable. However, if we just simply talk about medical aid, injuries, for example, they were reduced by 97%. Disabling events reduced by 99%. Compensation rates, what this one utility had to pay for compensation rate, it was reduced by more than 60%. And again, 2 gold medal awards, one for psychological safety, one for the safety culture. But Then we had our pandemic. How did our psychological safety program help us? Well, for one thing, it was recognized that physical safety and psychological safety had to be merged. So we now had a total health and safety group. It was recognized that unless you're feeling well about yourself physically and psychologically, you will not be safe. So your entire health, psychological and physical, as well as social, had to be optimal. It had to be looked after. And that was enabled. We were able to go ahead and start conducting research of the employees who were impacted by the pandemic to see, well, what effect is all of this change having on levels of anxiety, on their ability to be resilient, on their sense of loneliness, those who were locked down and didn't have anybody with them, and their overall physical as well as psychological safety. And what we found, because of a lot of our psychological safe programs we were putting into place, particularly resources that we were able to provide for employees and their families, anxiety levels weren't as high as what we were expecting. They were very resilient in how they were working and interacting with each other and staying safe. Loneliness, well, unfortunately, there were a few groups, mostly the younger groups who were living on their own, who experienced that. And safety took a hit, but only from the perspective that employees who were working in actual utility locations felt more unsafe than employees who were working from home. And, doing the analysis, it actually makes sense. You control who can come in and out of your home. You don't have full control over who can come in and out of your workspace. So that's where that number was coming from. We continued, based on all the research that we were doing, we continued to implement more psychological safety concepts. Again, each one hitting into those 13 factors. For example, mental health pop-up cafes were established. And those were a lot of really fun events. But you want to know something? In 2 years' time, there were over 200 of these cafes that were requested. And it was just simply pulling a group of employees together, either in person when that was available to us, or mostly online, and discussing one topic, and only one topic, for about 30 minutes. And employees knew that it was confidential. They knew that they could speak openly. Not all did. Not all were comfortable, but a lot were. And it worked well for them. We could talk about, for example, what the difference between feeling sad and what clinical depression was. We could talk about how to manage stresses of looking after children at the same time you're trying to perhaps process payroll. All of that got discussed during those cafes. The executive went through mental health training. We established a mental health helpline 24/7. Anybody could call it. And critically, we never stopped talking with employees. Communication was critical all the way through. And at the end of the day, all 13 factors of the standard were implemented. Now, I've underlined factors for a very specific reason. All 13 factors, everything that we went through quickly at the very beginning, they were implemented. However, as of today, the actual standard itself has not been implemented, not in this one utility. What I do know is, of the two utilities that were working really, really hard to implement that particular Canadian standard, one published their standard for their entire organization. That was Manitoba Hydro. They did an amazing job. The resources that they have available for their employees are top notch. The graphics, the paperwork, the brochures, the pamphlets, the programs, everything that they have made available to employees to just simply help them with the implementation and the acknowledgement that their complete total health and safety has now been looked after. It is worth everybody going online and looking it up because they did an exceptional job. One utility has implemented the standard. The other utilities, well, the one I work for has implemented all 13 factors. And please don't look at this from a negative perspective. It's not that they don't want to implement the actual standard. It's timing. Only so many standards get implemented a year to avoid overwhelming employees. This one is, my understanding is, it's lined up to be published. It just has not reached its publication date as of yet. But other utilities, interesting. Most other utilities in Canada have focused on a few factors, with the number one factor being the one that's referring to something that we call in the utility industry situational awareness, and as well the mindfulness program, that 40-10-50 concept that I briefly threw at you at the very beginning. Those factors are the ones that the utility companies are focusing on, trying to get them in place for employees because they recognize the impact that they have on employee physical safety as well as their psychological safety. So they're doing their best with what they can, with what they have, trying to choose the one that will have the biggest bang for the buck, so to speak. And it's still continuing. Fortis, one of the biggest utility companies worldwide, they've implemented the mindfulness program, situational awareness program in PEI, in Newfoundland, in Ontario, Alberta, Northern British Columbia, and parts of Ontario have taken it on as well. So they're still continuing to go ahead and implement. As late as August 24th of last month, a road construction company has come forward and asked if I would provide situational awareness and mindfulness workshops for them. So we know that they're seeing this, they're wanting to implement these factors in the workplace. They recognize the price tag associated with not doing it. They're not wanting employees to be unsafe, physically or psychologically. But again, resources are very limited for them. And the publication of that standard still is just sitting there. It's very much lacking. So a question for you is, we know respectful workplace, for example, policy standards are implemented 100%, but it's because they're legislated. So why does implementation of a safety program require legislation for companies to act? We have to recognize that factor number 4 of the psychological safety standard is respect. So we know that that part's been looked after, but it was looked after by legislation. So do we have to legislate the remaining 12 factors in order for companies to be able to simply say, yeah, okay, we understand we have to get this in place? Because it's so critical. It's so critical for overall health. This is the regulation. It's the New Brunswick regulation put in 2018, Occupational Health and Safety Act, Regulation 91-191. Every employer must provide employees with a respectful workplace to work within. Why can't we have that stating a psychologically safe and healthy workplace to work within? Because if it was mandated by law, that $50 billion price tag a year, we could reduce that. We could reduce that. You know, we could make sure that employees recognize that their company has their overall health in mind, and that their companies are keeping them safe in all aspects of safety. And, you know, quite simply, we don't need anything better than what we have. We don't need that better hard hat. We can create, we can design, we can develop, we can manufacture all the better hard hats in the world. But we simply need to know when our head is in the game and when we have to wear those hard hats, because that's the message behind that overall psychological safety program. We don't need a better hard hat. We just simply need to know when to wear it. So that is the award-winning image. Most of you have probably seen that before. It is NB Powers, 40-10-50 concept. That's the one that works. So psychological health and safety is all about making sure that we're nurturing our overall safety. If we're feeling safe at work, if we feel that we belong, if we feel respected, if we feel that we can handle our responsibilities at home from what our family's requiring, if we believe that our company is looking after our physical safety as well as enabling us to find resources when we do need that little bit of extra help, when we need a counselor, when we need a therapist, when we need to just simply sit down and talk things through, then we get that sense that they're really wanting what we can provide for them. Because that employee-employer relationship it's foundational to the quality of work that everybody is able to produce. And knowing that somebody is totally healthy, that's the key to all of it. And if total health is not being able to be realized, then at least is it possible that we're able to provide aspects of those 13 factors that employees can access so that they then can start looking after reaching that total health program? And nobody's expected to be 100% healthy. We know that that's the optimum and we're all striving to be that. But wouldn't it be nice if we could simply provide employees with whatever they need in order to try and assist them to get to some level of optimization? Anyways, we don't need a better hard hat. That is the slogan. The idea is, can we implement the psychological healthy standard in the workplace? And how are we going to do that? How can we help our companies do that? We know it can be done, but it's going to take a lot of work. And it's all about actively keeping it going. So I don't want to take a lot of people's time, but I do want to hear from you. I do want to hear your questions. I do want to hear your comments.
Great. And we do actually have a few questions and comments coming in. So I'll share them now. We do have a few minutes before we need to move on to the next presentation. So first off, earlier in the presentation, Caitlin Hayes had chimed in and said that they had seen many companies or government institutions ignore implementing psychological wellness because they feel it gets in the way of results or efficiency, even though research demonstrates that psychological injury is wasteful. So I think that was chiming into something that you had said previously about this perception that it was a waste of resources to address the issue, when in fact it's often quite the opposite.
Thank you. That's a really good comment.
And the next question from Peter Ross is, did you analyze how much your program cost and how much it saved?
Well, that's a really good question. Thank you. The analysis was based on the stats that I gave at the very beginning, where we reduced medical aid by the 98%, incidents, et cetera, 97%, that type of thing. That was the analysis. Now, are you ready for the really funny part of this? The cost of implementing now remember, the standard is not implemented yet. It's just components, just the actions. At the very beginning, when we were implementing the concepts of 40-10-50, mindfulness, etc., the cost was astronomical. It was so huge. Do you know what the cost was? It was my salary. It was, it was me going around and visiting every employee in person and sitting down with them and giving them the information and taking them through the actions. It was one-on-one, person to person. That was the cost. And of course, travel expenses because it's a provincial-wide utility, right? And so it was my time and me doing it. Now, as it was completed each time, and I'm not saying all employees signed into this because they didn't. It would be unrealistic to say, oh, yes, everybody loved it. A lot of times people would look at me and think, oh, she's crazy. We're not going to follow this breathing thing. Like, where is she coming from? However, when they recognized the benefits that it gave them over time, that's when the aha light came on for a lot of them. So from that point on, it made it easy because the cost got reduced. It wasn't just me, it was employees picking it up and taking it forward and teaching it to others. So it worked. And I'm talking not head office admin employees, I'm talking employees who work in maintenance departments in the plants. I'm talking the employees with the boots on the ground and out in the field and up the poles, driving the trucks, fixing boilers, that type of thing. These individuals were the ones who recognized the benefits of that type of training. I hope that answered your question. So yes, it was an extremely expensive program at the very beginning. Not really, but you have to have the resource to be able to do that. So that would be the cost.
That makes sense. Yeah. I've just sent you a quick link in the chat because we've got somebody asking. They said, is this the site you were referring to for the Manitoba Utilities Psychological Safety Program? And the URL is safemanitoba.com/psychological health safety. They said it was the only one that seemed to come up that was related when they did a quick search for it.
Yes, that is correct.
Great. Okay.
Now, Manitoba has been known for, I'm going to say 40 years at least of providing resource for employees. And I recall, wow, I'm going to say 20 years ago, they had on staff nutritionists who worked closely with the engineers so that they could provide food and recipe printed programs that they would send out to all employees and to the public, general public, to help them understand how to utilize the best types of cooking appliances for nutritious meals. So they were covering all aspects of attempting to look at health for all of their clients as well as employees. Should you use a microwave or should you use an oven? Should you use this? Should you use slow cookers? All of those types of appliances were listed according to how much energy they would use for particular types of meals. So they were doing really well back then. They're doing even better now.
Great. And we got somebody chimed in the chat saying New Brunswick Power also. I'm not sure exactly what that's in reference to, but something that you've just been discussing.
Okay.
I'm just going to share one comment and then we're going to have to move on to the next presentation. But we had somebody in the chat say, I love that you introduced to me the concept of the 40-10-50. Increasing that capacity within the 10% using mindfulness is an excellent goal. There are so many benefits to present moment awareness beyond physical safety. It is so worth working towards. So that was just a comment for you.
Oh, well, thank you. Thank you.
I see that there's another question in the Q&A, but we are going to have to move on. Dr. Shelly Parker, though, has kindly shared the presentation. All of this will be available afterwards. And if you have follow-up questions, you can always get in touch with us at the organizing committee and we can see if we can help connect you with some information. So thank you so much, Dr. Shelly Parker, for this presentation and for your patience while we worked out the translation issue at the top.
Oh, you're welcome. And thank you everybody for being here. It's really important.
Yes, thank you so much.